types of blood vessels. You see here an overview. We have on the upper left-hand side an artery, on the upper right-hand side a vein, and at the bottom we have a capillary, which we can see is the smallest vessel. It is one thin layer with a basement membrane because it has to support the exchange of gases like oxygen and CO2. So we'll look at each one of these individually. Notice that there's more elastic, more muscle, thicker wall on arteries than there are veins because they sustain a higher amount of pressure. So we can see this in the chart. You've got two types of arteries, really three if you consider an arteriole a type, but you've got elastic arteries and muscular arteries, which both have this general structure that we see in figure A, but elastic arteries just have well-developed elastic laminae, which are just layers of elastic tissue to provide it stretch. They tend to sit closer to the heart. And muscular arteries have well-developed thick muscular layers in one of the layers of the vessel called a tunica media we will look at, and they help to regulate blood pressure and control blood flow to organs by adjusting the lumen of the vessel. Arterioles are a branch off of an artery into a capillary, the smallest vessel where we're going to see exchange of fluids. Venules and veins lead back toward the heart in the systemic area, and they lead back to the heart also coming from the pulmonary circuit. So remember, arteries carry blood away from the heart, veins carry blood back to the heart. Venules bridge the gap between the capillaries and the veins, and veins take blood back to the heart. And because the blood in the veins generally is a bit of a lower pressure, they don't need as thick of a muscular and elastic layers as the arteries do. So you'll see that they are thinner walled. So looking here at an artery, if we look at a cross-section through a microscope, you can see that there is this really thick layer in the middle called the tunica media. So there are three tunics inside a blood vessel, and these just refer to layers. The inside is called the tunica intima or tunica interna, and it is one thin, slick layer of simple squamous cells supported by a basal lamina. You don't want anything to impede blood flow, so they are one thin, slick layer. The tunica media is this thick layer in the center. It's got an elastic lamina and smooth muscle. It's got elastic around that smooth muscle layer. And that's what you can see here, this thick tunica media in the cross section. But remember that muscle is to control blood flow and pressure. Whenever it constricts, we call that vasoconstriction, and it makes the lumen of the vessel smaller. When it relaxes, it's called vasodilation, and it makes the lumen of that vessel bigger, and it can therefore control pressure and flow. And finally, on the outside, this is called the tunica externa. You can see that here on the outside labeled here in the cross section. But an external layer is many times for protection. So notice that you've got a lot of collagen in that outer layer. This is the outside of the vessel. So arteries are carrying blood away from the heart. Here we can see the normal cross-section compared to vasoconstriction, which makes the vessel smaller, and vasodilation, which makes it bigger, which is controlled largely by that thick muscle in the tunica media. The elastic arteries are also known as conducting arteries, and we said they have more elastic and less muscular layers. They function as pressure reservoirs and are generally closer to the heart. For instance, the aorta coming from the heart is very elastic. Muscular arteries are also known as distributing arteries. They are medium in diameter, and they have more smooth muscle and less elastic. And they help to control blood flow and distribute it to different parts of the body. Now notice we still have the three same tunics in a vein. We've got the tunica interna, tunica media, and tunica externa. The tunica externa is still a collagenous layer for protection on the outside. Tunica media still is made of mostly smooth muscle, and you've got some elastic there, but you don't need as much elastic and definitely not as much muscle. So we can see in that cross section, the lumen of a vein in a cross section looks a little larger, but you have a much less thick tunica media supporting it, so they tend to collapse more in a cross section than the tunica media of an artery. So when we look at a cross section of an artery, Veins are actually larger, but they appear collapsed in a cross section because they don't have the thick tunica media supporting it like the artery does. Another big difference you'll see is the tunica interna has these little upfoldings that make valves. So these are venous valves, and they are located in superficial vessels in areas like the legs because they are preventing the backflow of blood where those superficial veins bringing blood back to the heart are not supported by thick muscle like the deeper veins are. Notice here we see a cadaver figure of the cusps of some of those venous valves. They're very simple because they're just infoldings of the tunica interna. They're very similar to the aortic and pulmonary semilunar valves in the heart, but those valves will help prevent backflow in those thin veins. Venules are the smaller vessels that connect capillaries and veins. They are very similar to this type of structure that we see in a vein. And capillaries are the thinnest vessel. They are just one layer of simple squamous epithelium supported by a basement membrane, and they are thin because this is where we have gas exchange. So notice the thinnest capillaries, or the smallest capillaries in the body, are small enough that red blood cells must stack up on one another to get through them because they're only one diameter of the diameter of one red blood cell. So your veins actually contain the most blood at any given time, so they serve as a blood reservoir. If you need to start pumping more blood through the body, you can push that blood from the veins toward the heart. But right now at rest, the largest portion of the blood lies in your systemic veins, as you can see in this distribution pie chart, where most of your blood is lying at rest at this moment. And of course, some of the capillaries we said are microscopic, single layer of cells. Because their walls are so thin, they permit the exchange of nutrients and waste between blood and tissue. So capillaries are a great example of how the structure of the body relates to the function. So at the pulmonary capillaries, you can take oxygen in and CO2 into the alveoli. At systemic capillaries, you take oxygen into the tissue cells and CO2 enters the blood to travel back toward the lungs. We have capillaries that branch to form networks through the tissues in the body. Notice that there are little areas called meta-arterioles and sphincters that can relax and contract, and they can control blood flow as it goes through the body. There are three types of capillaries. The most common one is a continuous capillary. You find those in most areas such as the nervous system, respiratory system, muscular system, and even in the skin. Again, they make up most capillary beds. They are interrupted by little spaces between cells called intracellular clefts that will allow certain substances to go through, and we'll see these types of capillaries a lot in capillary exchange. Fenestrated capillaries look very similar, except notice that it looks like somebody punched holes in your cells. Fenestrations are just small pores covered with a little diaphragm open in your blood vessel. You're going to find these in areas where you need more exchange of materials, such as when we absorb nutrients in the small intestine and when there is exchange to make concentrated urine in the kidneys. So we can see here in this image, labeled M here is an intercellular cleft. And then the sinusoidal capillaries look very weird. It almost looks like somebody has just punched this capillary and damaged it to death, but these don't usually have a basement membrane. They're just very large portions of the capillary gone. They're winding, they're wide, and you find these in areas where we take in red blood cells to recycle them, like the spleen, or where blood cells are made and they must leave in the red bone marrow. So those are two special places that we would see the sinusoidal capillaries. So we can see here the summary of continuous capillaries, fenestrated capillaries, and sinusoidal capillaries. Continuous are the most common. You see fenestrated in kidneys, endocrine glands, and small intestine. Sinusoidal capillaries where you take in red blood cells and where you are making them. So it depends on how leaky they are. The continuous are the least leaky, and then of course the sinusoidal, because of all those spaces, are the most leaky.